Welcome to Benita's Maternity Program webinar. Today, Dominique Leclerc, a qualified physiotherapist, will be explaining to us what we need to know and how to manage preterm babies.
In line with World Prematurity Day, we thought it was a good opportunity to be more informed about preterm babies. This day is important as it raises awareness to preterm babies, and it also helps identify where mothers are needing support. It was on the 17th of November 2020. Did you know as many as 1 in 10 babies are born preterm worldwide? So what is preterm birth? A full-term baby is about 40 weeks, but can go up to 42 weeks. A preterm baby is any baby born before 37 weeks, and then a late preterm baby is born after 34 weeks, but before 37 weeks. So why should mothers be aware? Premature birth rate has risen by 30% in the last 25 years. Infants born early are at risk for developing delays and health problems, and early intervention from therapy teams such as physios, dietitians, OTs, and speech therapy can play a vital role in reducing these risks and improving overall quality of life. Therapy teams develop treatment programs to help your preterm baby reach their full potential. So possible causes for preterm babies. So this can be genetic factors, either from the mom or the baby, and this can play at least a 40% part in all preterm births. There can be multiples in the womb, so twins or triplets, mothers younger than 19 years old or older than 40 years old. If you have had any prior preterm deliveries or previous concerns about your uterus, high blood pressure, so preeclampsia, especially preeclampsia beginning in a mother after 20 weeks of pregnancy. If there are any premature ruptures of the placenta, a lack of prenatal health care, or the use of drugs or alcohol during your pregnancy. So just looking at a few signs and symptoms of preterm labor, if we're looking at the mother, this could be any early contractions, any bleeding, or any leakage of amniotic fluid. So what happens immediately after your preterm baby is born? So firstly, your medical team will immediately assess your baby's health, and they will start treatment as needed. For warmth, your baby will be placed in a heated trolley, a beanie, and warm blankets will be applied to your baby. If there's any breathing difficulty, a face mask with oxygen will be applied. The heartbeat of your baby will be assessed. So if the heartbeat is below 100 beats per minute, then additional oxygen support will be given. And then once stabilized, there is a score called the APGAR score. And this is basically a physical examination with a maximum score of 10. There are 5 domains that your baby is rated, and then each domain is either given a 0, a 1, or a 2. So this is just the heart rate, the breathing, muscle tone, reflex, and skin color. And then once your baby has been stabilized and the scores have been carried out, your baby will then be moved to the appropriate unit. So just looking at a timeline of what to expect. So for example, if your baby is born at 26 weeks, the size of a baby will be quite small. So usually they will fit quite snugly in the palm of your hand. So at this point, the main job of your baby is just to grow, sleep, and become medically stable. The movements, there will be no motor planning. So you'll often see a few jerks or twitches, which is very normal. And then their hearing is fully developed. So they might be able to hear you sing to them or talk to them, but they can't respond just yet. In terms of breastfeeding, you won't be able to breastfeed your baby just yet, but that will come later on. And then the skin is very sensitive. So you won't be able to stroke your baby, but you can do a comfort hold. So that's essentially applying a very light pressure with your hand. If your baby is born between 26 to 28 weeks, they will very slowly start gaining a little bit of weight. The movements, so your baby's tone will still be quite low, but there will be some twitches that you might see. And then coming to the hearing. So they might respond a little bit or become a little bit stressed, but they will start showing signs of responding to you. And then feeding wise, still won't be able to breastfeed, but you will start seeing some sucking reflexes at the lips starting to form. So this is when they're going to be learning to know how to suck. And then the skin is still quite sensitive. So if your baby is medically stable, you can start with Kangaroo Care or skin to skin, but this is with the guidance of the nursing staff. And then at 28 to 30 weeks, you will start seeing the muscle tone improving, and they'll start to move a little bit and stretch. And then the rooting reflex begins. So this reflex is essentially when the head starts turning from side to side, and this is when it becomes very important for breastfeeding. Your baby will start responding to pleasant sounds, but they'll also be a little bit sensitive to negative ones. So any sounds that are quite sharp or sudden. And then with regards to breastfeeding, you can start getting ready for breastfeeding, and that's only if you've noticed the rooting reflex that has begun. The skin is still very sensitive, but you can start with a bit more of a hands-on touch. Then at 30 to 33 weeks, the movements are a lot smoother. So you'll see your baby starting to bend their arms and their legs on their own, a little bit more controlled. And then with regards to hearing, try use your voice to sort of guide them on what you're going to do next. So associate it with an activity. So tell your baby, okay, we are going to change your nappy now, and then start with the lifting the legs just so they don't get a fright. And then breastfeeding, they will start sucking rhythmically. They will also start to smell your breast milk. And then start by using your fingers, obviously wash your hands, but just start rubbing their lips gently just to get that sucking reflex going. And then at this point, you can start with very gentle baby massage. I'll get to that a bit later. And you can do nice hands-on touch. At 33 to 36 weeks, their movement very smooth, it's controlled, and starting to bend and move on their own. And then you will then be breastfeeding. So it'll be more or less similar to 30 weeks. So the 30 weeks and the 36 weeks, there isn't too much of a gap. But then when they reach 37 weeks and beyond, so their movements, their head, you'll start seeing moving from side to side. They still won't be crying that often just yet, but they'll start crying when they're able to start indicating what they're needing from you. At this point, you should be breastfeeding and a lot of hands-on touch and gentle baby massage at this time. So looking at caring for your baby, what is your role at this point? So there are many ways you can contribute to your baby's well-being and development while they are in the neonatal ICU. So it's quite important to work with your multidisciplinary team. That is your team I spoke about earlier, your therapy team, your doctor. So give them your views, raise your questions, and make decisions for your baby's care. So don't be afraid to ask questions and to be very involved. It's important for you to be a presence in your baby's life. So provide love, affection, and warmth as possible or as suitable. And then very importantly, to start with expressing milk. So you can initially start with hand expression just to start that stimulation, that milk production. Usually if your baby wasn't born early or you started immediately with breastfeeding, that's when your baby would trigger that letdown reflex. This is where it's important for you to start with your hand expression. Then it can be given to your baby either via tube, so tube feeding, or by a bottle, depending what is suitable for your baby. It's important that your baby does get breast milk. This will help a lot with growth and putting on weight. So also reading your own baby's cues to see what their signs are depending on their needs. So if you see your baby turning away from you, this means that they might be overstimulated and they might need a bit of quiet time. If they are extremely active or fussing, they may be hungry or they might be a bit agitated and need some help calming down. If their face or their body tenses, they might be in a bit of discomfort. But if you see their body relax, their eyes open, then they generally are quite content. So this question I get quite a lot is when they can start washing and caring for the baby's skin. So just be very careful. Frequent washing can do more harm than good. Especially some soaps and lotions can be quite harmful to the baby's fragile skin. So that's why it's important when you are washing the top and the tail, so the head and the bottom, use only water. Don't add any soaps or any specific baby soaps you might see on the market. Use cotton wool balls soaked with lukewarm water just so they don't get a fright and that it's quite comfortable. And then with regards to drying them, don't friction them with a towel, rubbing up and down, rather snuggle them dry. So a bit of a patting them dry, especially in a warm environment where there's no draft. And then also just have a towel just to sort of swaddle them in afterwards. So very important is bonding with your preterm baby. So I just want to stress this enough. Moms mustn't feel this pressure that immediately after your baby is born, they get whisked away to the neonatal ICU. Now you must stress about bonding immediately. If you are feeling stressed, just take a breather, take a relaxing time. But there are certain ways that can sort of help you just to start that connection with your baby. So with regards to holding, even if you aren't able to pick your baby up, they might even find it comforting just to hold your finger. So just to slide your hand in through the incubator and give them a piece of you to hold. Stroking, this can be quite reassuring for your baby. So do it very smoothly and very gently, but firm enough that you don't end up tickling them. Use your voice. So this is especially important. They could hear your voice the entire time while they were in the womb. So that will be quite nice for them and quite relaxing to hear your voice again. So you can gently sing songs to your baby, talk to them, or just making cooing sounds. Maintaining eye contact. So this is crucial for bonding. Look into your baby's eyes and play with them by showing them different expressions, whether it is smiling or looking surprised. Objects, you can start with just simple black and white striped objects or toys, nothing fancy. And then just massaging, you can use gently warmed vegetable oil. So by gently warmed, I mean using your hands to friction the warmth, not a microwave or heating up on a stove, please. You can apply gentle but firm strokes, and then also carefully watching to see where your baby likes being touched. So as you're doing the massage, see what they enjoy the most. So looking at Kangaroo Care, I mentioned it earlier when I was talking about the timeline. So Kangaroo Care is a method of caring for your stabilized, low weight or premature babies outside an incubator. So this is essentially strapping your baby to your chest with skin-to-skin contact and helping to maintain a healthy, normal body temperature. So how to do it? Preferably if a nurse who is trained in Kangaroo Care will guide you initially, but just so you have an idea too. So wearing a front opening top, always wash your hands before picking up your baby. Your baby doesn't have to wear any clothes, a nappy and maybe a beanie if needed will suffice. And then place your baby on your chest. So if the mom is doing it between the breasts, and Kangaroo Care is also quite beneficial for the dads too, for the dad to also start with the bonding process. Wrap your top around your baby to keep them nice and warm. Lean back, relax, and just enjoy that moment with your baby. So there are times when Kangaroo Care is not suitable. So especially when babies are still very premature or if their health is unstable. So for others, it might only be advisable for short periods or maybe even once every few days. And it also depends on which hospital you're in. So some baby units, they might be unwilling to offer the care if they are not familiar with this way or do not have the resources to carry it out safely. And then timing is very important. So units whose staff have experience with Kangaroo Care, they are often happy for parents to practice it from around 28 to 30 weeks. And then just very briefly touching on the feeding of your preterm baby. So just because you gave birth prematurely, this does not mean that it will prevent your milk from coming in or your body from actually producing milk. So just the extra stress, fear, discomfort, and fatigue that goes along with the birth of a preterm baby can also cause a slow start to milk production, but with patience and support, you can express and breastfeed quite successfully. Breastfeeding your premature baby will boost their health, and this will also help you develop a bond with them. So just very important, there are many components to planning the feeding of your baby, and this will be done in consultation with your pediatrician as well as the dietitian. So it's very difficult to give a guideline or what you can expect with regards to feeding with extra supplementation, extra formula, breast milk. That will be done according to your baby's needs. So just looking at the positioning for your baby. So if there are any breathing difficulties, the baby stays on their tummy for most of the time in the early days after birth. And this is purely because it aerates the bottom of the lungs a lot better. As time goes by, you can start introducing containment. Again, the nurse will help you and guide you on when it's appropriate and suitable. So basically, the baby is limited with roll-up towels that they can push up against. This mimics the womb, and it also starts the babies with flexing and moving their muscles. Nesting is also an option. So that's essentially when you build a nest of rolled up blankets and cushioning under bony parts of the body. And then your multidisciplinary team, they will assist with different positions and what is appropriate for your baby and future developments. So for when you go home or as your baby gets a little bit older. Very, very important. I would suggest any mommy with a preterm baby ask and join support groups. This will help the mother express a lot of your feelings of stress, anxiety. You might feel very disconnected to your baby and a lot of fear. So it's very important to be very open about this and join support groups where you can. And then just very important that preterm babies prevalence is high, as I mentioned earlier. So I just want to stress that mothers are not alone and that help is there if needed. Looking at a physiotherapy role in preterm babies, it's quite important for mothers to be aware of typical milestones. So remember, your baby is born earlier, so they need to catch up to a typical age. So in the beginning, it might be a bit slower, but with therapy, with a few techniques, we can then help your baby reach their full potential. So a specialist physiotherapist who assesses muscle strength, tone, neurological signs, and just to monitor the rate of your baby's development is very important. So usually our plan involves muscle strengthening exercises, stretches so they don't become very stiff, activities in supine, so that's lying on their back, or lying on their side, rolling, sitting, social skills and participation in play is also equally as important, and then just positioning advice and equipment if needed. So your baby's rate of improvement will be monitored and reevaluated regularly. This is using our outcome measures. So this will help us monitor improvements in your baby's functional ability and also just to see the baby's muscle strength. So as your baby grows and develops, your physiotherapist will adapt the treatment so that it is fun and there still challenges your toddler later on. And then very important, I want to stress that if your baby did not receive physiotherapy in hospital, but later down the line, you are noticing that your baby is struggling with movement difficulties, or there's a lot of low tone, or the baby feels very floppy, or if you've noticed that according to a typical child development, you might be 2 months, 3 months delayed, or you see your baby struggling a little bit, it would be best to consult first your pediatrician or your pediatric physiotherapist. But I just want to stress that you don't need a referral from a doctor if you are concerned about any movement problems.
Thank you for joining our webinar.